what new intraocular lens technologies can we expect in the future? That's a great question. I would expect the intraocular lens technologies to keep getting better, but it moves pretty slowly. Every couple of years or so, you'll get a new lens. Sometimes these new lenses aren't going to be markedly different from existing lenses. Maybe they're optimized, but the results, after seeing many of these surgeries, it's basically the same. In the last round of intraocular lenses, they were all updated very well. The PanOptix Pro, the Odyssey, all just a huge step forward from their predecessor. So for the PanOptix Pro, the predecessor was the PanOptix Classic, and the Odyssey is the new form of the Synergy and the Symphony from Johnson & Johnson. To going into the future, maybe in the next 5 to 10 years, there's discussion that there can be an accommodating lens. An accommodating lens is one that moves inside the eye. And this lens will utilize the eye's own ability and the small muscles inside the eye to change its position, to move a little more forward, a little more back, and be able to then focus light as you would naturally. So then you would use a monofocal lens that moves and allows you to see near and far using the natural way that you see near and far, which is to use the muscles to move this lens forward and backwards, akin to changing the shape of your natural lens, making it more stronger for near vision and a little weaker and flatter for distance vision. My thought is we've never had a lens like this. I should take that back. There was a lens called the Crystal lens from Bausch and Lomb, and that lens didn't survive. Nobody implants those lenses anymore. That lens was supposed to move as the eye muscles move inside the eye, but it, to my knowledge, didn't really do that very well. And sometimes it can adopt a Z configuration, which means that the haptics of the arms can bend in such a way and then lock it in some kind of tilt. But until we see one that works, and I think we're at least 10 years away from that, maybe not in my career, the concern is that the lens will scar down. So anytime things inside the eye tend to scar down. As we all know, we develop posterior capsular pacification. The tissues, after you remove the lens, tend to become pretty at the mercy of these scar tissue forming. So there's discussion that these lenses somehow prevent that scar tissue forming, and that could be true. But until we see it, in my mind, I'm a little skeptical that anything can move in perpetuity inside the eye. Now it can move, probably in the first several months of using it, but you never know when the scar tissues are. I think they're inevitable. I've probably never met a patient that didn't develop, to some degree, some scar tissue around the intraocular lens. So, we'll just have to see on that one. Now, the other lens or lens system is one where we can adjust the lens. And we already have the light adjustable lens, but that lens is sort of at the mercy that you have to adjust it in this time period right after surgery, and then hopefully that lens then stays the same and you don't have to do any more adjustments for the rest of your life. Whether that's true or not, it's usually true, but what if, right? So the new adjustable lenses may be able to be adjusted in perpetuity, which means forever you can come back and adjust the lens with an optical system. And I think that's powerful. I think the technology is based on changing the index of refraction in the plastic or whatever the material is inside the intraocular lens. So being able to deliver energy and change, make it a little stronger in certain areas of the eye, so higher index of refraction to bend light more. So I think that's promising. They're doing similar things with your living tissue on the cornea. I think it's called lyric, and that's also very exciting. But these technologies are slow to develop anything new like this. Like, for instance, the light adjustable lens took probably more than 20 years to come to market from inception. So the timeline, I think, was 1997 or 96, where the technology was born in California, and then it wasn't until 2017, so 20 years later that, or 21 years later that they got it to launch and come to market. I'm sure there's other things that are being developed that are very secret that I'm not well informed on. But you can be sure that there's going to be new things, better things. It's just the way modern technologies work through innovation, and we hope to see better and greater things obviously come out. That's very exciting for us. In terms of, that brings up the question, well, there's always going to be something better. Should I wait? Absolutely, you can wait. There's no harm in waiting. There's never any harm in waiting, unless you have you're blind from cataracts or something. Then maybe it's a safety risk to wait any longer. Maybe you should get it done and taken care of. But now, if you did the surgery now and something comes out later on that's pretty similar to our current lenses, I can't imagine something significantly different. We can certainly take out the old lens and upgrade it to the new lens. But if the new lens system is one that moves and maybe placed in some other part of the eye, it's hard to know what these new technologies are. But if it's significantly different, it's not compatible with the original surgery. By the way, the original surgery hasn't been changed in the last, however many, 3 decades, 4 decades or so. So it's unlikely that the surgery will change. But who knows? Anyways, hope that helps. Hard to predict the future, but certainly we can upgrade the lenses. That tends to be pretty routine to do for us. So, if you were happy, but then ended up just, the fear of missing out, your friend then got a lens that they rave about. You can come back and we can discuss maybe upgrading your lens to that one. But just keep in mind that the cost of doing a lens upgrade is going to be more than your original RLE surgery. It is more challenging surgery, for those factors. That's why it's probably best to, if you're happy with what you have, just stick with it. No reason to take the extra risk of doing another surgery to have a slight edge over what you currently have. But yeah, risk and benefits are always something that we're happy to discuss with you. Okay, thank you.